The last person thought to be infected with Middle East Respiratory Syndrome tested positive for the virus once again late last night here in Korea after he made a full recovery from the MERS earlier this month. Although health officials say it's highly unlikely the virus will spread, more than 120 people have been quarantined so far. Connie Kim has the latest.
The Korea Centers for Disease Control and Prevention said Monday the 35-year-old man has tested positive for MERS 2 times and is currently under quarantine at Seoul National University Hospital. Before that, he had been discharged from the hospital on October 1st after testing negative for the disease. Health authorities say it's highly unusual for someone who has fully recovered from the disease to test positive again.
The patient visited and received treatment at the designated clinic at Samsung Medical Center on Sunday after contracting a high fever and vomiting. He was transported to Seoul National University Hospital on Monday at around 12 p.m. and admitted.
A doctor at SNU Hospital said a minuscule amount of viral DNA has been detected in the patient who had been dealing with malignant lymphoma prior to his initial MERS diagnosis. It's been reported the man's genetic analysis is slightly higher than the normal reading for a MERS-positive diagnosis. However, health experts say the amount of virus detected in the man is not enough that it would spread to other people, and the chance of infection for other people is near zero. Still, as a precaution, the Korea CDC has quarantined the man and 129 other people who came into contact with him.
The virus is highly contagious when a person who has MERS symptoms, accompanied by a high fever, coughs and the virus infects another person. As that is not the case with this patient, it is highly unlikely that Korea will suffer another MERS outbreak like the one in May and June.
Since the first MERS case was reported on May 20th, the disease has infected 186 people, killing 36. Prior to this week, the government had planned to declare an official end to the MERS outbreak on October 29th. But with the latest MERS test results, the Korea CDC says it'll discuss setting a new date for the end of the outbreak with health officials and the World Health Organization. Connie Kim, Arirang News.